for joining us. My name is Allison Campbell, Communications Supervisor here at the Brant County Health Unit. Today, Dr. Comley, Acting Medical Officer of Health, and Dr. Joanne Tober, BCHU CEO, are joining me. And before we begin, could we please do a quick roll call for everyone joining on the line with us? Please state your name and affiliation.
Michelle Ruby from the Expositor.
Hi, Michelle.
Patty Berardi, Rogers TV.
Hi, Patty.
Hi there.
All right, and so before we get started, we just kindly ask that you please self-mute your lines to minimize any background noise. And as always, there will be an opportunity to ask questions upon conclusion of the statement. I'll now turn it over to Dr. Comley.
Thank you for joining us. I'd like to start by passing my condolences to the loved ones of the community members we lost recently to COVID-19. Yesterday, the province announced the next steps in its reopening plan. Beginning this Thursday, additional capacity limits will be lifted in various indoor and outdoor settings where proof of vaccination is required. Provincial plans were also shared regarding the removal of proof of vaccination requirements for all settings on March 1st. To view the complete list of anticipated changes, please visit the province's website. As Brant begins to reopen, it's important we do so cautiously and gradually as we make sure we are evaluating and understanding our local context and conditions. The lifting of capacities allows for greater opportunities for close contacts, and I encourage everyone to continue to practice public health measures as well as getting vaccinated. This will help ensure we are entering this new stage safely and protect and progress we as a collective have worked so hard to achieve. The province expanded booster dose eligibility to youth aged 12 to 17, 6 months or 168 days after the second dose. We are now accepting this age group at all BCHU-run immunization clinics. Youth must be 12 years old at the time of vaccination, and all eligible individuals may book an appointment or walk in at any of our community clinics. Appointments and clinic information can be found visiting our website. Child and youth vaccination remains an effective method to provide protection to our children, their classmates, households, and communities. Children and youth who are vaccinated are less likely to get infected with COVID-19, which minimizes potential disruptions to both education and extracurricular activities. I encourage anyone who has questions regarding vaccines, whether it be regarding a first, second, or booster dose, to speak to a knowledgeable and trusted healthcare provider to help inform their decisions. Parents and caregivers may also visit our website to access important child and youth vaccine information by visiting www.bchu.org/kidsvaccines. Thank you.
Great, thank you, Dr. Comley. We'll now open it up for questions.
Hi, it's Michelle from the Expositor. I just wanted to ask Dr. Comley about the protests that are happening across the country and locally, and what kind of a message would you send to those people who are involved in these anti-mandate, anti-vaccine rallies and protests?
Well, I'd like to say certainly that I think this kind of division is not constructive. I think that we have to continue to focus on us as a collective versus the vaccine versus us against each other. I think that we as a province are making steady progress, and I think that we have to focus on that progress instead of the division that these occupations have created.
Thank you.
It's Patty from Rogers TV. I just have a question. And as things open up, and we know that March 1st, the vaccination passport will be eliminated for some settings, some people might feel nervous about returning to a restaurant, maybe not knowing if people are vaccinated. What is your message to people in terms of being confident about being safe, returning to somewhat of a normal life again?
I think it's important to remember that we have a layered approach to preventing COVID-19. And so right now we're starting to peel back a few of those layers. And if we peel them back slowly, I think that is the safest way to proceed. The biggest protection we have, as we've said over and over, is vaccination. And a booster dose actually provides significant protection against transmission as well as protection against severe disease. So I think with a booster dose, that can provide a lot of confidence that we can go out and start to do more of the things that we've missed so much. I think everyone has a bit of a risk-benefit calculation to make on their own, given their own situation, and that can be difficult over time and stressful. I think if people are taking cautious and calculated steps themselves, that they should start to feel comfortable about doing a little bit more, which will help everyone's mental health in the long term.
Thank you. And just in terms of school vaccination clinics, how is that going? Are you still offering vaccination clinics in school? Are we getting a high turnout?
Yes, we are still offering clinics in schools. We are doing them 3 days this week, and we will be carrying on and doing them next week as well. So our plan is to go to most, if not all, of our local schools and offer the program. We are seeing a good turnout, and we're happy to be able to supply the vaccine in such a convenient way for the families and the children.
Great. And now for someone who might be between 12 and 17 that have been double vaccinated but also contracted COVID, a lot of students did over the Christmas break and into January. How long do they have to wait before getting that booster? Do they still need a booster even though they may have already had the infection?
NACI recommended this was an adult recommendation, but waiting 3 months after infection as the recommended timeline before getting a booster dose. Certainly, I would be using that same recommendation around the 12 to 17 age group as well.
And are there any worries? I know that a lot of people had concerns about men or boys getting the vaccination and issues with, inflamed heart, things like that. What is your message in terms of getting that booster dose and the safety of it for young men?
Well, I'd say that NACI recommendations for this age group are not as strong as others for the booster dose. And they, in fact, had a longer timeline. Ontario has recommended a longer timeline. I think in this age group, the risk of COVID-19 is also lower, so there is a bit more of a risk-benefit calculation. NACI recommended this for individuals who had higher risk for complications from COVID. So this is something that individuals should evaluate and decide whether or not they want to have a booster if they're in the 12 to 17 age group.